Hi, I'm Sam Diamond, and I serve as the Senior Director for Health Financing at the Clinton Health Access Initiative, or CHI, where I co-lead a global team that works with over 80 advisors in ministries of health, finance, and insurance agencies in governments across Africa and Asia. When I first heard from the WomenLift Health program over a year ago, I had a difficult decision to make. I was already pursuing a part-time doctorate degree, and I had recently learned that I was pregnant. So I was working on creating more time and more space for my family. I was no longer sure that I could invest everything that I wanted to into the WomenLift Health program. But I am so glad that I did take this opportunity. I am grateful to have had 29 WomenLift peer mentors, colleagues, friends, and frankly, cheerleaders in a year where I became a first-time mother, where I went through my oral exams for my doctorate degree, and where I came back from maternity leave to take on more responsibility through a promotion at work. This past year has allowed me to reflect on the fact that to take on the types of big and messy problems I want to in my career, I'm going to need to build strong teams and create coalitions. And I want to take a moment to acknowledge that the work that I'm about to present is work that I helped to catalyze and resource, but that my team took forward while I was out on maternity leave. And I want to thank them for their support over the past few months. So what is this challenge that my team and I are working to address? Right now, in the African countries where I work, women and girls have to pay more than they can afford for the most basic healthcare, services such as an antenatal care visit. I think about a 19-year-old woman who is pregnant in a rural town in northern Nigeria. She will have to make trade-offs between paying for food for her family and paying for her healthcare. Even if she makes it to the health facility, finding and paying for transport, she may find that this facility is not equipped to provide care, and a nurse may have to charge her $1.25 for essential supplies, a user fee she may be unable to afford. She may not seek care again until there is an emergency. My team and I are supporting policymakers who are seizing this moment, overcoming economic challenges and budget constraints to implement insurance and tax financed reforms, and ensuring that these reforms are intentionally designed so that this 19-year-old does not have to pay more than she can afford for the basic essential healthcare that she needs. In 2022, my program was being asked by our major funders to conduct gender assessments. I was honestly wary. In my opinion, there have been too many tick-the-box exercises for donors in this space, and exercises that highlight what we already know. Women and girls are being left behind. I wanted to try to make sure that gender did not become an add-on, but rather that gender equity was a core part of our work. So we set out to try to do something different. We assessed the gender responsiveness of our ongoing work and defined the entry points that we already had to improve on this. Through this assessment, we saw that in some settings, there are challenges in ensuring comprehensive sexual and reproductive health is covered, or ensuring that women have their own health insurance card so they can seek care without having to ask for their husband's permission. We heard that addressing this would require bringing in new perspectives, from bringing in civil society to improving diversity in leadership positions in health financing. Yet leadership in health financing is generally characterized by international rather than local experts and by local health economists. And everywhere in the world, health economics is a field that lacks participation from women. There were many entry points that were identified by our technical advisors and the policymakers that they work with in order to center women and girls in health financing reforms and to support women in health financing. I have grouped these into 4 main areas that my team and I are planning to work on moving forward. The first is to train CHI advisors on gender mainstreaming. We started this in the past year with help from consultants, but recognize this can't be a one-off exercise and it can't be contracted out. The second is for these advisors to work with governments to more systematically address equity and specifically gender equity. This is again not about creating a siloed work stream. For example, we'll work with policymakers to surface sex disaggregated data and to use this evidence to inform planning and budgeting exercises that we are already supporting. The third area takes a longer-term approach to solve for health workforce challenges. We'll work with universities, governments, and other regional institutions demanding health financing skills in order to create a more gender-balanced health financing workforce with women in leadership and management. This may range from thinking through who is recruited to who is trained and how trainings are conducted. It will also include work to amplify the voices of female leaders in this space as role models. And finally, in doing this work, we looked at the makeup of our own health financing technical advisors and managers, and we're committed to improve the participation of women from countries where we work in management positions. As I reflect on our strategy, I have been thinking about what role I can play to help catalyze change, also considering that I'm from and currently based in the US. I am committed to continuing to build strong teams and partnerships that can work on these context-specific and long-term challenges. This includes using my role to secure resources for gender equity and female leaders in health financing in the countries in Africa where I work, and to strengthen and establish mentorship and fellowship programs geared towards early to mid-career women in health financing. In other words, I want to create an environment where women in health financing can thrive and receive the types of support that I have been so grateful to have had these past few months from my team and from WomenLift Health. Thank you.